Hey guys, I'm Sebastian at Performance Place Sports Care. We're going to cover a sports hernia exam today. Many of you have been looking online for what an examination might look like with a sports hernia, trying to confirm your sports hernia diagnosis. So I'm one half of the locally world famous chiropractors in Orange County, California. Come see us if you have groin pain. So the area we're talking about with the sports hernia is we're talking about right around here, around the flank, and just into the center here where it's still kind of fleshy. You can have pain here or here or here. That's associated, but a lot of times people experience it right here when they do so. And so the first thing we're going to do, go ahead and Mary Lou, go ahead and stand right here. I'll pull back just so we can see the exam. So stand right there and just make sure the cameraman gets all of her body. And so usually what an examination will look like is we'll take you through a variety of movements just to see if we can challenge certain structures. Because if in theory, if your abdominal area has been torn, it'll present itself with some type of movement. A lot of you will say, well, it only hurts when I run. Well, we can simulate stuff like that, walking upstairs, deep hip flexion to really challenge the area. This will also screen out other types of diagnosis like hip impingement, labral tears, referral from the spine, and so on. So go ahead and feet together for me. Bend forward as far as you can. Let me know if any of this bothers you. And come on back up. Give me one more of those, okay? Usually I'll stand in front of them just to look and see. Go ahead and back up again. Can you bend backwards as far as you can? Now sometimes people with groin pain don't like this. Go ahead and come back up. They'll feel like it comes into here a little bit. And so an easy thing to do is hands on the hips now. Push the hips forward. Don't try to lean back. And so now we're pushing more extension through the hip versus the abdominal area. Because again, if that abdominal area really has a strain or a tear, then we're challenging it via a stretching mechanism. So other things, do a little teapot, go like that for me, and like that. We're also testing some hip range of motion, and give me a little slow twisty twist. Okay, as you see, Mary Lou's hips are rotating nicely, as well as the rest of her body too. That way looks a little sticky, but she can turn generally and look over her shoulder. Okay, let's try a deep squat now, the best squat that you can do. Good, come on back up. Try a couple of these. Okay, Mary Lou likes to shift to this side of her body. And so it's actually very common that people have groin pain in the side that they shift weight to. She might have had a left turned ankle before. Did you? Did you?
Yeah.
There you go. So some of you will probably wonder, like, why did this happen? Why does this keep happening? So the body likes to compensate. It is not always painful to compensate, but when you have to compensate, sometimes overload in that area produces the problem. So it's more of an underutilization of the other side of the body, at least maybe in her case. Now let's take and actually stress test the hip a little bit. Go and line your back for me. Now, I know I mentioned hip a lot already, but it's good practice to make sure that when you're being examined for a sports hernia, that we need to make sure we stress test the area here, which we'll do in a second, but also look at the areas surrounding, such as the hip and the lower back. We won't do the lower back too much today, but we will do a couple tests which are they're neural tension tests, because sometimes the referral from the back is really common here. So the first thing we're going to do is stress test the area here, and if she walks in like this, we can do this, but if she's just lit up, we probably wouldn't want to do this. Okay, I'm going to put my fingers just kind of in the fleshy area down there. Okay, and so maybe that's where you feel your symptoms. Can you do a little quarter sit up for me? And down. And again, and down. One more. No problems with that?
No.
Good. And so what we're looking for is a clear divot forming or a lag, okay? And so when we find that, there's a possibility that you do in fact have a sports hernia, since if we're looking at a sports hernia, it's going to be a tearing of the fascia down there. But if there's not really anything found in this, then you probably don't have it. Now, some people will say that you do tests like push me that way, like a resisted adductor one, and that'll light them up. Yeah, it'll probably light them up. And if you had a cut on your hand, you decided to punch a wall or squeeze it a lot, it'd probably hurt it too. It's not an indication that this is actually a sports hernia, but it'll give some light about what movements bother her. You know, so you could do a MRI or ultrasound. Most people don't need it, but that'll confirm beyond reasonable doubt if there's actually a tissue disruption or a tear within the sports hernia area. Most people do not need it before starting care. All they need is an exam just like this. So the next thing we like to do is stress test the area, specifically more in the hip. And I'm going to be looking right here to see if she has any tendencies of not using or not being able to stiffen her spine, because if she can't, then she'll have overload into that region too. Go ahead and hold me. Good. And relax. Does that hurt you?
No.
Good. Pull me down. Hamstring curl. Good. Kick me up. Good. And we'll do the one that everyone likes to do. Pull that way. Good. And the other way. Good. So we stress tested the area pretty good. All right. Not highly sensitive. Why did we do the hamstring curl one and stuff? Because all those muscles cross the hip. And as we know at this point in time, if you have a sports hernia or a groin pain, you're going to have some type of hip problem. Whether it's underutilized or overutilized or muscular imbalances, you're going to have some type of hip problem. So we need to normalize the function of the hip. Okay? That's probably the most important takeaway in this. Most people don't need surgery. They need to make sure their body's working well. So the next thing we can do is something, this is more examination deep within the hip socket, but I like to grab the leg right here and hold it nice and firm. And so we're going to scour the socket of the hip. And so I'm going to push her hip up into the hip socket and then rub the rim and see if it lights her up or not. For a lot of people, going across the body like this will light them up. And they're like, yeah, that's my symptom. In that case, this is probably not a sports hernia. It's probably hip impingement. If it's a deep clunk and a painful clunk and click and associated with this test, or they're just blocked, they can't go in and they can't turn like this is probably more of a labral issue. Okay? And that's a labrum of the hip. We'll also check the outer part. We'll drive into different quadrants of the hip. And generally we can see her hip moves nicely. Is it functioning well? That's a different story. But it doesn't seem like there's any large arthritic findings in there. There's nothing we need to do surgically to this hip. And lastly is we see if this is a positive. This is called Faber's test. Now, usually we'll look at the other side to see if there's asymmetries with range of motion. I don't know what we're going to find on her. I'll stay over here just because of the camera angle. But this side feel a little tighter for you? Or is that your phone?
Chapstick.
Okay. Okay. And so going outwards here, I'm looking at generally knee to foot position here. Roughly, let's just say that's 1 hour if we're doing a clock, a big clock. I don't know what this one will do. This one's like 2 hours, 3 hours. So a lot more range on this side. And in the squatting pattern, you didn't put weight on this side. So this side's getting a little extra work. Yeah. Okay. We do all the same tests on the other side of the body. And go ahead and we're going to do one last one as a test to see if this is maybe from the back. Go ahead and go seated for me. Okay, these tests are a little bit more out of order. If we were in a real setting here, we'd screen the spine out first. Do you need images to do the spine? No, you don't. You don't need an image to confirm if you have a disc herniation or a pinched nerve or any of that stuff. It's extra information. It's not bad. It's not needed though. In most cases, we can do it all like this. And so the next thing we're going to have Mary Lou do is just scooch back a little bit for me. And so can you go ahead and get real depressed? Head down even. There you go. Some people, this will actually create their groin pain. And so there's nothing really changing much of the hip. In fact, the hip itself will actually open up range here because she's in a posterior tilt. The ab wall, do you feel like your abs are working at all? They're not doing anything, right? They're not stretching because she's not extending. They're not contracting hard because she's not throwing anything or running. But this stresses another part of the body, which is the back side of the spine. And this would be more confirming of maybe a disc, okay? And so this one's an interesting one, and you can actually double down on it. Go ahead and grab the edges of the table. Don't move your body, and go ahead and pull the seat. There you go, right there, and just relax. Good. So if that increases it, this is a further confirmation we're looking at a low back disc. Again, easy to address, but it's really commonly associated with sports hernia presentation or groin pain. How does it refer to there? You got to trust me on this because this is probably, we have a whole nother video on our channel on this specifically, but I won't spend time on it doing this today. Here's the last test. Go ahead and stand. This test, turn towards me, just knee up and just stay. A lot of times people will have pain with this and they'll have the duplication of the groin issues that they came in for. So this can irritate a sports hernia, FAI, or hip impingement, labral tears, even some low back other side. Generally, you should be able to do about 10 seconds pain-free, but a lot of times people will be able to they'll do 10 seconds, but they're like, yeah, that hurts. And so a good test after is to give an intervention, go and relax. You give an intervention such as a treatment or position of comfort, something that chills their pain down, and have them retest. And so that's all we really have to do with a good physical exam for a sports hernia. Sports hernias do not need they don't need a lot of equipment nor expensive images to really find out what's going on. And so if you think you have a sports hernia, or if you don't know what the heck it is even, find someone who can do this. If you don't know anyone around who can do it, or if your clinician didn't do it for you, you can come see us, all right? We have online as well as in-person availability. So all you have to do is start the process and just talk to us. So email us, info@p2sportscare.com, or call 714-502-4243, and we'll take you through the process. If you feel like you don't want to talk to us at all yet, at least go on to our channel, subscribe. There's a little button somewhere. It's red. And for the people who subscribe, there's a search bar right there, and you can search what you want to look for. We have a lot of sports hernia videos that you can certainly watch. And if you feel like you're resonating well with it, just reach out for help, because people try to do this stuff by themselves all the time. It takes months to years, and it's really frustrating not being able to do what you want to do. So yeah, if you have any questions, talk to us. See ya.